If you're searching for a free AI alternative, you're probably trying to find an AI scribe that fits your clinical workflow better. Freed is one of the well-known AI scribe tools, and a lot of clinicians compare it when looking for help with notes and documentation. But the best AI scribe is not always the most popular one. It depends on your specialty, your note style, your templates, your EHR workflow, your budget, and how much control you want over the final note. So if you're comparing freed AI alternatives, here are the main things to look at. First, look at specialty fit. A therapist, psychiatrist, primary care provider, physical therapist, pediatrician, and chiropractor may all need very different documentation. For example, a therapist may care about DAP notes, BIRP notes, GIRP notes, treatment plans, interventions, patient response, and progress toward goals. A medical clinic may care more about SOAP notes, assessment and plan, follow-up instructions, clinical summaries, and documentation that is easy to move into the EHR. So before choosing an AI scribe, ask whether the tool actually understands the kind of notes you write every day. This is one area where Twofold can be a strong freed AI alternative, especially for therapists, psychiatrists, behavioral health clinics, and small to mid-sized practices that need flexible clinical documentation. Second, compare template control. Some AI scribes generate a note that looks clean, but it may not match your actual charting style. Maybe you want a specific SOAP structure. Maybe your practice uses DAP or BIRP. Maybe you need custom sections like medical necessity, interventions, client response, risk assessment, or treatment plan progress. A good freed AI alternative should let you customize the output so the note feels usable, not just impressive. With Twofold, clinicians can use different documentation formats, customize templates, and create notes that better match how they actually chart. Third, look at workflow. Most clinicians do not want another complicated system. They already have an EHR, scheduling, billing, messages, and a full patient load. The AI scribe should be simple. Record or dictate, generate the note, review it, edit if needed, and move it into the chart. That kind of workflow matters a lot for private practices, small clinics, and teams that want to start quickly without a long implementation process. Fourth, compare privacy and compliance. Any AI scribe used in healthcare should support HIPAA-compliant workflows and offer a BAA when needed. You should also understand how patient data is handled, whether the tool is built for healthcare documentation, and whether you can review and approve the note before it goes into the chart. That is true whether you choose Freed, Twofold, or any other AI scribe. So who is Twofold a good fit for? Twofold is a strong freed AI alternative for clinicians and clinics that want fast AI-generated clinical notes, flexible templates, SOAP, DAP, BIRP, and other note formats, HIPAA-compliant documentation support, and simple setup for real clinical workflows. It is especially relevant for therapists, psychiatrists, behavioral health teams, and small clinics that want something practical, flexible, and easy to use. The best freed AI alternative depends on what you actually need. But if you are looking for a fast, flexible, HIPAA-compliant AI scribe for clinical notes and documentation, Twofold is definitely one to consider. Try the tools side by side, use them on real documentation, and choose the one that creates notes you would actually feel comfortable putting into your chart.